University of Medical Sciences, and I'm so glad to here with you. First of all, I want to ask the audience to not to turn on their webcam, please. And we are streaming live on Facebook, so please don't turn on your webcam, and then write your question in the chat box in English, please, at the end of our speaking. I want to say welcome to everybody, and now I want to ask Dr. Ali Sohrapour, the Vice Chancellor of Education in Tehran University of Medical Sciences and founder of Mentoring Office in Tehran University of Medical Sciences for the first time. He was my teacher also. And as a scientific chair, I want to ask to start the meeting, please. Dr. Sohrapour, we have you here.
Thank you very much, Mariam. Do you hear me?
Yes. Yes.
Yes. Very nice to be at your service in this webinar. I'm glad to introduce our respected guests here. I'm Dr. Amir Ali Sohrapour. Actually, I'm a GI man. I'm a gastroenterologist. I'm the Vice Chancellor for Education at Tehran University of Medical Sciences. I'm interested in medical education. Actually, 10 years ago, we established the mentoring office in the Faculty of Medicine, and I have the honor to be the director. It is mainly based on near-peer mentoring. Also, I have the honor to have been the director for faculty development in the EDC, Education Development Center, here at TUMS, TUMS, our university. I'm glad to introduce our respected guests here. Dr. Elizabeth Krajic Kakur, PhD, is the Director of Medical Education Development Global Consulting. She's based in New York City, working for multiple institutions in the US and elsewhere. Her medical education practice spans from curriculum to faculty development, learner assessment to program evaluation. She has been working with simulated standardized patients since 1982 and with OSCEs, OSCEs, and similar types of performance-based assessments since 1986. After working for Einstein Medical College, Interfaith Medical Center in Brooklyn, New York, and New York Medical College, she became an independent consultant in 1997. Dr. Kakur has published widely, including being co-editor of a book on OSCEs. She has presented at 200 plus national and international conferences in person and virtually. Welcome, Dr. Kakur. We're very glad to have you in our seminar, actually webinar. I'm glad to introduce Professor Meli Elchin. Meli Elchin is currently the head of the Department of Medical Education and Informatics in Hacettepe University Faculty of Medicine, based in Ankara, Turkey. He is the founding head of the Department of Simulation in Health Sciences in the same university, Graduate School of Health Sciences. He's a specialist in family medicine and has a master's degree in educational sciences. He's a certified healthcare simulation educator, advanced grade. He's the recipient of 2019 ASPE Outstanding Educator Award. His areas of interest are program development and evaluation in medical education, clinical and communication skills training, healthcare simulation, interprofessional education, patient and healthcare worker safety, and medical humanities. He has over 50 peer-reviewed papers in the fields. And our special, the last but not the least is Dr. Mandana Shirazi, my respected colleague at TUMS. She is associate professor. She is the she's an affiliated associated professor of Karolinska Institute. She's the founder of Standardized Patients Unit in Iran. Actually, the first and unique SP or Standardized Patient Office was established by her at Tehran University of Medical Sciences in 2007. She is now the Deputy of International Affairs for Medical Education Department here at Faculty of Medicine, TUMS, and also the Acting Director of Innovative Educational Strategic Office at EDC in our university. Actually, she is now supervising more than 40 theses at PhD and MS level in the field of applying standardized patients for assessing health profession performance. She's also conducted simulated web-based teaching courses through DLS at virtual faculty of TUMS. Besides being part of organizational committee of CIMEC, CIMEC and IMEC, she is also running several national and international SP workshops in high-stake seminars like AMI, and she has published 64 papers, articles in the field of medical education. She's mainly interested in simulation, specifically standardized patients, CME, interprofessional education, art in medicine, and best evidence in medical education. Again, I thank all the respected guests here in our seminar. I hope everybody will enjoy a fruitful seminar with very nice discussions. To you, Mariam.
Thank you, dear doctor. Here I want to ask Dr. Mandana Shirazi to tell us about some words simulation description and the situation of using simulation in the COVID area in our country. Thank you so much. Dr. Shirazi, may we have your voice?
Hello, everybody.
Turn on your voice, please. Turn on your webcam.
It's on. Okay. Hello, everybody. It's my honor to organize and participate in this webinar regarding the simulation, which is field of my interest. In the beginning of my speech, I would like to, the title of my speech is regarding the simulation in health profession, past and present in COVID era. I should answer during my presentation to two main questions. What is the simulation and its situation before COVID-19? And then I should answer to this question that what types of simulations are actually at the moment using in Iran during the COVID-19. Oh my God. What should I do?
Dear Mandana,
you can't see my slides, yes?
Yes, I don't have these slides on my screen.
Yes, yes. And then sharing. I think that now it should be okay. Can you see my slides?
Yes, great.
If you let me, I continued it with two main questions that I should answer it to part of it at least during this limited time. The first one is that what is the simulation and its situation before COVID-19? And the second one that I should answer is what types of simulation are using to change and improve the process and procedure of educational environment in response to pandemic COVID-19 in Iran. In the first step, I would like to have the same definition of simulations for some of our participants who may not be so familiar in this area. Simulation actually refers to an artificial representation of a real-world process to achieve educational goals through experiential learning, or according to the Society for Simulation in Healthcare, simulation education is bridging between classroom learning and real-life experience. It has also four purposes. Their purposes is in education, assessment, research, and system integration. Simulation history, if we look at the simulation history, it's not a new. Actually, it has been used 2000 years ago when the med student used cadaver in order to learn more about the anatomy of the human body. And the first simulator was produced in 1911 by Mrs. Chase in the nursing faculties domain. And if I would like to categorize the simulations, I can put it in four groups: technical, non-technical, virtual, and hybrid. The technical refers to some simulation which is assessing or teaching based on the hard skill. It's some manic surgery as the example. Or if we would like to speak about the non-technical simulation, which emphasize on some communication skill, trait, IPE, and so on. And we can also use SP, for example, for teaching such a kind of this non-technical simulation. Virtual simulation is the topic that my colleague Meli Elchin will talk about in detail in this regard, so I don't want to enter in this part. And the hybrid simulation is integration between technical, non-technical, or technical and virtual. For example, we can consider that when we have a injury, patient who are suffering from injury in the simulation parts in the emergency ward, we prepare a manic who has some suffering, who has some problem in some parts of its body. And then the hybrid simulation, I mean the SP, is waiting in other places, and he or she answer to the questions that the personnel of healthcare who are working with this manic ask the manic. So this is the integration between two kinds of category, technical and non-technical. This is the example of it. And let me to make it full screen, sorry. These are some types of simulation: full body manic, video-based simulation, three-dimensional statistic model, task-specific simulator, audio simulations, virtual reality, computer-based clinical simulations, human cadaver, written simulation, which is exactly the same as a scenario, standards patients, that I love it, and animal models. One of the slides that I think that the important message of my first question is upon is simulated-based educational system. That in our poster also, you can all see the picture of it. We can use simulation as a teaching tools. You can see that the This is some of the students who are trying to experiment some injection in some kind of mnemonic. And we can use also in assessment tools. For the assessment tools, we can use the charts, computer charts, or we can use the standards patient in the OSCE examinations. However, if you would like to use the simulation for teaching purposes or assessment purposes, we should consider it in the curriculum. And one of the important parts of the simulation that I think that is inevitable, it's very important, is feedback. This feedback could bring up to the student by the internet-based training performance feedback, by the charts, and then the answer that the student type and then get a feedback. Or even more, it can get a feedback after the session that they have with the standards patient as an educator. And after this session, the standards patient will give them some feedback, which is very important for their future work. And in most of the time, I use simulation in our research, because sometimes it's impossible that for the first time we use it in the we use the clinical situation, real clinical situation, I mean, for doing some research. So first of all, we should do it through the simulation setting, then go through the clinical setting. And also we can use simulation for outcome and impact measuring, which is even the most important parts of the use of simulation. This is why I like very much these slides and the message of this slide. Well, the next one is that there are certain samples that most common use of simulation in assessment. For example, OSCE, that all of you are familiar with, objective structure clinical exam, or OSPE, that objective structure performance exam, that we normally use this one in some paraclinic setting. And OSCE, that I have asked also my very nice colleague Elizabeth to talk about more in this regards. It is a teaching evaluation. I mean, this is focused on faculty assessment, which is very important parts for the exam. Now we reach to the second questions. I should answer to this question that what types of simulation currently apply during COVID-19 in Iran? It has been used in different fields. Actually, it has been used in as a virtual reality at TUMS by one of my colleagues, Dr. Aghili, and his group. But unfortunately, the use of virtual reality in Iran is sporadically, and it needs still to be established. I did the very brief survey in order to understand, because Iran has more than 51 universities. So I have asked some of them that what is going on during the COVID era regarding the use of simulations. And these are the answers that I get together. In our university, we have the infrastructure for virtual reality, augmented reality, and so on. But unfortunately, they are using sporadically in different departments. It's not well organized in order to use by all of our students. And still our OSCE, we couldn't use this method. It is in, it's just regarding in the domain of the teaching and also in the domain of the research, but still regarding the assessment, we did not use it. I hope it happens in the future time by increasing the budget by Dr. Sohrabpur kindly and their support in order to establish this kind of method in our university. And one another university is Gonabad University that they have used they have founder by Dr. Mircharaghi, and he have used the virtual reality for as a OSCE examination. But that one was also in the research field, and it did not also established, unfortunately. But we have all in infrastructure, and we can establish it if we have some support in this regards. What I would like to say that, so what we are doing at the moment regarding our high stake exam, because before graduating of medical students, they should pass the high stake exam in order to be graduate. And what is the role of SP in OSCE during the COVID? Then there is a new protocol of high stake OSCE, which was developed by ESCI Lab and Dr. Boston Hack and their colleagues, and applied this protocol during COVID-19. Some items of this protocol is consist of reduction the number of participants in each OSCE, and instead increasing the number of OSCE. For example, in each year we run more than 14, in each year we run 3 national OSCE exam, but in this year we run 7 high stake exam of OSCE in all parts through our university. And the reduction number of lines and rounds, for example, they consider only 1 line instead of 2, and also consider 3 rounds instead of 6. And in some stations, the raters act as an SP, but it doesn't happen in all of the stations, but in very few of the stations, they did this job. And the important point is applying SPs in only 25% of stations instead of 35% of stations, which was common before COVID-19. And we have considered social distance and increasing the spaces between students and try to give more space to the people. And also we consider all WHO protocol in order to inhibit of any contamination in this regards. And if you want to have any further information regarding what they have done, I put the citation of their article, which is the letter to editor, beside these slides. I would like to thanks of all of my colleagues, especially Dr. Sohrabpur, that support us in all parts of the arrangement of this meeting, and also my very nice colleague Elizabeth and Meli, that we know each other from many years ago, and all of us are the member of the Association for Standards Patient Educators. And a special thanks to my colleagues that I obtained some information regarding that what is going on in our university, Dr. Aghili, and also Dr. Mircheraghi and Dr. Boston Haq. Thank you very much. And these are my emails. If you have any question, I am at your service. Thank you.
Thank you, dear Dr. Shirazi. May I ask you to unshare your screen, please? Now we, yes, and turn off your microphone, please. So now in this part, I want to ask Dr. Kakur to tell about something about simulation situation in the US, and here you are, Dr. Kakur.
Okay, get my screen up. Can you see it? Can you see my screen?
Yes, we have.
Okay, great. So let me just put it on in the right way so that I can show my slides properly. I have some animations, so I'm trying to get it, but now this is covering up the, let's see, no, sorry about that. Trying to get to animate the slides, but this is in my way.
Can you see the slideshow button in the lower part of the your screen?
That's a problem. I don't see it because I have the Zoom.
Please click. Oh yes. Do you see it? Click on the screen or a slide.
Well, that's what I can't see the slide. I can't see the button to because the Zoom banner is in front of it, so I don't know what.
You can use the button above of the PowerPoint software.
Oh yeah, okay.
Slideshow.
Slideshow. Yes, of course. And here we go from the beginning. There we are. Okay. So welcome everybody. Hello from New York City, where I'm located at the moment. And I'm really happy to join you all and share a little bit about the experience that we've had here in New York City and in the US. You see New York City skyline and the Brooklyn Bridge on this slide, as well as some of the standardized patients I've been working with, some of them over a decade. So the presentation I'm going to structure using this crisis management model. And of course, here in the US, we don't just have COVID, but we also had the Black Lives Matter crisis. That was another crisis that's still going on. And we also have a political crisis, but for the purpose of this presentation, I'll focus on COVID. So what happened before COVID started? And there wasn't much preparation, but there were a few resources that we could all build off on. just about every medical school, every residency program, well, maybe not every residency program, but simulation centers are pretty common here, and they've been quite established. Most places also have quite some good experience with standardized patients and the set of people who they use on a regular basis. There's been some experience with remote standardized patients. I worked on a project almost 10 years ago, utilizing standardized patients in different parts of the country, actually, to explore the way of communicating with them via Skype, using Skype to engage them in encounters with learners. There's also been a remote OSCE and a virtual OSCE that was established quite some time ago, but it's been limited. And the internet capabilities in the US have been pretty good. Most SPs have quite stable internet, and actually have been using Skype primarily in order to train standardized patients for quite some time. Another thing is the professional networks, and was already mentioned, the Association for Standardized Patient Educators and the Society for Simulation in Healthcare. They have become quite established in the US, and I know also in other countries. So there's a little bit of resources that we could draw on when it happened. The Association for Standardized Patient Educators also developed some standards of best practice. And one of actually the first domain refers to a safe work environment. And that's really was important also as we were entering the COVID situation, because safety is a concern that we all need to have, not just for ourselves, of course, but also for our standardized patients and the way that we work with them. Moving forward, then COVID happened. So here are our wonderful standardized patients, and then COVID happened. So the first reaction was OSCEs were canceled, programs were postponed, everything was being rescheduled to sometime in the future, and the standardized patients were pretty much out of work. There are some places in the US where standardized patients are treated like employees of an institution. They were a bit differently situated, but in New York City and as well in many other places, they are basically contract workers. So no OSCE, no work. So my question for myself was, so what is our responsibilities as SP educators? And I'm using SP for standardized patient or simulated patient, or simulated learner, simulated teacher, any human being that's being simulated. So my response to that was, we have to help standardized patients become remote standardized patients. It was clear that the situation could not change so quickly, and we need to adapt to working with standardized patients in a remote way. So I developed very quickly, this was finished in March 20, already a month later, a list of standardized patients who were interested in becoming remote standardized patient. And the interest was very high. I had 60 people on this list, but there were many more that came afterwards who also wanted to be on the list. What I learned from developing this list is the importance of continuing my relationship with them and enhancing their relationship with each other. And actually there are some programs who've developed some regularly scheduled social hours for the standardized patients, even if they're not working in the simulation center at that time, but just to keep them engaged and reduce some of the isolation that we, of course, all feel. Putting together a list like this, the information must be helpful, and we know that selecting standardized patients, we always need to know what they look like. So I also included some pictures via links. And I was concerned to include standardized patients who have had prior experience as well, so they were not new to the field. I tried to distribute it as creatively as possible to many places, so that individuals, not just from the US, but from all over the world, could take advantage of it. And I have to say for myself, it's also been helpful to have a list like that, because it could, once the OSCEs restarted virtually, I was able to take advantage of it myself. Moving forward towards stabilization, I think at the moment, the situation in terms of SP simulation has stabilized a bit more, although the numbers are increasing again, and OSCEs are canceled again. I was supposed to have run an OSCE this coming Friday, and it was postponed. But moving into a more stable situation, OSCEs have become pretty much virtual everywhere. Even the national board exams are now considering virtual OSCEs. They were also canceled for some time. So here is a picture of one such OSCE station. You see it happens, the residents, in this case, internal medicine residents, they are in a simulation center, and they are sitting in front of an iPad, which is located on top of a tripod. I'm sorry, the picture is not too good, but you see it on the left of this resident. And that's how they are encountering the standardized patient. That's what you see then on the Zoom screen, because most of them are organized via Zoom. So you have a standardized patient on the bottom, and then you have a student or resident on the screen, and the faculty is on usually off screen, but you know that somebody else is watching. So what are the concerns learners have when they are on a Zoom OSCE? Well, they are worried about how they can communicate virtually, although we do that now socially so much that it is not so difficult as it may have been in the beginning of the crisis. Standardized patients, they also wonder, they are located in their home, and they wonder whether they can really play the role well, and whether they can be believable as a patient or parent, family member, whatever the situation is. And faculty, here you see myself really, but this is just to show you and give you an idea of how that works. We also have concerns about, not being interrupted, not having anything, any cat coming on, or anything else happening that would interfere with the professionalism of the OSCE situation. So there's a good amount of anxiety that goes along with virtual OSCEs as well. But generally, they have been quite successful, and they will be with us for some time to come. So sometimes we use in OSCEs a video that is that shows a scenario that the learner then has to respond to. So we have in this picture, you see a simulated resident who is sitting there. And we have a simulated medical student who is interacting with her. And this particular station relates to burnout it's a burnout situation where the resident acts in a very aggressive way to the medical student, which is of course unprofessional. It's part of a professionalism OSCE. So with COVID, the SP was not available, and we needed something that would be appropriate for the learner to react to, and we want the simulated, patient on the video be the same, the resident on simulated resident on the video be the same as the one they will encounter in the OSCE station. So we had to develop a Zoom video that would provide the same stimulus for this station. So we have to figure out some creative ways to manage the current situation. There's always debriefing after OSCEs with most of them, especially if they're formative. And of course, that looks very different now as well. So just to give you an example about what the residents think or what the learners think about these types of transfer from in-person to virtual. This is a program evaluation about a specific station on sexual harassment, where the learner has to confront someone who has been accused of sexually harassing a medical student. And we asked them afterwards how they felt about the encounter at the station, and you see the questions we had here. So we compared the OSCE in 2019 when it was in person to 2020 when it was virtual. And really all the evaluations, there was no difference except for the prior exposure to this type of scenario, which was higher in 2020. But otherwise, there was no difference. And we also asked them on the evaluation form how they feel about doing these encounters online. And as you can see, 92% of them thought that it was not that different. So moving on to recovery. I hope we all will be in that stage very soon. And COVID will disappear, but we know we have still a little bit ways to go. So there have been various documents that have been developed and statements that have come out on how we can get back to having SPs work with learners in person. And another thing that I think developed in the healthcare field is the move towards telehealth. And so whatever we are learning now about using virtual OSCEs will be very helpful as we are trying to prepare learners for virtual encounters with real patients. How can we best recover? Well, here are some tips, guidelines, what I think could help us now and will help us in the future. Maintaining the connection, developing the connections that we have amongst ourselves with the standardized patients, with the different centers around the world, really, including this very useful webinar, and enhancing communications, different kinds of sessions, of listservs, of chats that can be established. We need to be compassionate, of course, with our standardized patients and with each other about the stresses that we're all undergoing. And we need to have a lot of creativity to manage it and learn from it, to use the silver lining of the current crisis to move forward. There's some references, and you can check them out afterwards. I know it's being recorded. And then I want to say thank you, and I look forward to any questions you may have.
Thank you, dear Kakur, for your description about the simulation situation in US and your attractive PowerPoint. Thank you so much. It was good, and I want to ask Dr. Meli Elchin will give us an overview about the simulation situation in Turkey and also about the virtual reality as well. Dear Doctor, we have your voice.
Thank you so much. First of all, I want to thank you, the organizers, for inviting me to this symposium, to webinar. I will share with you first my presentation. And I hope it works. Okay. I will talk about the simulation in Turkey amid the COVID-19 pandemic. My steps, first I will talk about the programs we use simulation before the pandemic, and then the emergency remote teaching phase, and the last online training phase. We have some activities based on simulation in the medical curriculum in our school. We have two programs. One of them is Good Medical Practice program in the first 3 years of 6-year medical education, and communication skills, clinical skills, and to some degree ethics are discussed and taught by means of simulation in this program. We have a newer one, interprofessional collaboration and patient safety program for 2nd and 3rd year medical students, and collaborating with other health sciences students, but mainly for medical students. And there's also communication skills with SPs and clinical skills. And I have a special elective course for 3rd year medical students, communication with vulnerable groups, and it's also a simulation-based activity, and we use SPs in those activities also. And we have some courses for dentistry students, and we again use simulation in those courses. These are communication skills course and clinical skills course for dentistry students. In March 16th of 2020, all schools were closed in Turkey. All primary schools, high schools, and universities, all of them are closed. And it's really a sudden thing for us, and we were not prepared for this moment, and we are shocked, and we really couldn't do anything for those. We tried to provide some emergency solutions, and we call this period emergency remote teaching period. And we could do what we could do in those days. So we didn't have any plan. We didn't have so many resources, and we did some small things, and mainly based on presentations, recorded presentations for lectures, and we stopped all the experiential learning parts. And in the second part of the COVID-19, we are now better prepared for the activities, but again, it's very limited because all our schools are still closed. Only the 6th year students in the phase of their internship are in the school and working as a kind of physician assistant, and all other students are in the online training. During the emergency remote teaching part, we had some kind of pilot studies with very small groups. We had some communication skills with SPs. For example, in my elective course, we have only 18 or 20 students in that course. So with one or two SPs, we tried to do something by means of simulation. And in the dentistry part, we tried to use SPs again to evaluate their performances. It's not a kind of OSCE, but it's only one station, and students interviewed with the SPs, and we evaluated their performance by means of communication. And for clinical skills, again, we organized some evaluations for dentistry students. We did most of the assessments in dentistry school because the numbers are smaller in the dentistry school. There are 150 students in the dentistry part, and they had already completed their course programs. So we had already taught them till the end of the school, till the closure. And we tried to finalize their courses by evaluating them. So hand washing or wearing masks are the two stations, we can say, and they performed hand washing and wearing mask and taking off mask in front of the cameras, and we watched them via Zoom and evaluate their performance. So these are very limited activities, and we couldn't do more during the spring semester of 2020. So in summer, we spent really very much time on thinking and finding solutions for the next year, because it seemed we will go on doing things online. And we developed some solutions. First, we designed a kit, an individual clinical skills learning kit for each student in our school, in the first 3 years of our school, with different content for each year. And we put them in a box and planned that if they had their own box in their houses, we can teach them some skills on the screen and via Zoom. So let me see if the video works. Okay, this is how we organized this and send it to our students. In the meantime, I want to say that we have 500 students each year. So we have 1,500 boxes to be sent to our students. And the training started. The left corner on the here is the tutor's side. First, he showed how to do steering on the pad, and then observe the students and provide feedback during the session. And the students didn't pay anything for those boxes. They only paid 10 Turkish liras for the post office, which is around $1 or $1.50 United States dollars for each student. And all the material, the cost of materials are covered by the university. And it's very interesting because we are a governmental institution, and it's very huge work to organize 1,500 boxes, paying the cost and sending it to our students. But it worked, and everyone is really happy nowadays. For the ones that has limited resources, it's those students are the dentistry students. Unfortunately, their administration couldn't find a resource for buying the boxes and sending it to the students. We used different methodologies, and we taught intramuscular injections and oranges. Students bought themselves the injector or the other materials for learning injection and use it on the oranges. And as you see, there are eggplants and zucchinis, and we prepared first. We work with students to prepare. It's like a small set for intravenous injection. So we taught them how to prepare IV line and how to perform intravenous injection on those models, on those simulators, let's say. So we taught clinical skills for dentistry students on those oranges and eggplants and zucchinis, and for our students using the boxes. And for communication skills, this is our new center. The screen in the middle is the waiting room, and the others rooms for students to interview with the patients. This is the center we designed for online training in the new year. Let's watch it. Students had interviews with the SPs in the rooms. Then they came back to the waiting room and leave the room. And when a student leave the center, a new one enters, and then the coordinator sends him to the room, and the student enters the room and begins interviewing with the SPs. All those interviews are recorded via Zoom, and we use those recordings for debriefing sessions. In those sessions, the tutor with 16 to 18 students watch some of the videos and provide feedback. for the performance in interviewing with the SPs. So this is the new era for us for communication skills. And new improvements, we didn't use some other types of simulations in our university. I mean the virtual reality, augmented reality, because we have lots of students, and the cost of such kind of simulation for 500 students in each year is really an expensive thing, and we couldn't do anything till this COVID era season. But now we thought that we should do something. So we begin to think about how we can use virtual reality. First of all, I want to show you what virtual reality provides us, how can we get help from virtual reality. So this is a video with different types of virtual reality.
Acil entübasyon, medikal durumlar nedeniyle hastanın yaşamının tehdit altında olması.
You can teach some procedural things using virtual reality.
Hastanın dil köküne gelince epiglotun da kaldırılarak vokal kortları görebilmemiz amacıyla laringoskop uygun açı ve doğrultuda tutulmalıdır. Serum fizyolojik çekilmiş 10 mililik enjektöre bağlı iğneye uygun derecede eğim veriniz.
You have to wear your special head-mounted glasses for those virtual reality activities, and you should have some tools in your hands, and with the help of these tools you can have an experience of 3D and perform some procedures on patients. This is virtual reality, and if we go on, this is also a virtual reality where you can get information from the patient. Again, the same process with head-mounted glasses and tools in your hands, and then choose your questions and get answers from the patient.
Bazen yarım saat, bazen de 1-2 saat sürüyor. Yaklaşık 7 ay önce hastaneye gitmiştim ve bana evre bir hipertansiyon tanısı kondu. Bu yüzden ilaca gerek olmadığını söyledi bana doktor.
So you can also make some physical examinations, measuring blood level. And now it's augmented reality. The room is the real room, and you have some virtual patient here, and it's the same process. For the rest, you can do everything, but you can also see the real environment around yourself. These are the products that we can buy and use in such days where we cannot do anything in face-to-face. But the problem is the head-mounted glasses. They are very expensive, and you cannot send them in the box and send them to the students easily. And sharing the glasses is impossible in such days because the contamination risks. So we decided to do something on screen using the same methodology, the same simulation type, the virtual reality. And there's a special group of virtual reality. They call it serious games. It has the same logic of playing games, but the situation is serious, so they call it serious games. And we tried to prepare some serious games for our students, especially for our interprofessional collaboration and patient safety program, because we completely stopped doing everything in these programs. So we try to develop a training module for patient and health worker safety. And we try to include all those patient safety and health worker safety issues in our program, international patient safety goals, donning and doffing PPEs, emergency situations and emergency codes, blood culture, basic and advanced life support, safe surgery, safe transfusion, confidentiality, evaluating pain, evaluating fall risk, evaluating the nutrition situation of the patients, evaluating the limitations of the situation, adverse and sentinel events. All those are included in our virtual reality screen-based training program. You can write your, oops, sorry, my last video. Here are the 9 modules. We have completed the first 4, and I'm sharing the videos from the first 4. First of all, there's a patient room.
Merhaba, ben de tam çıkıyordum.
You enter the room and check the safety points here. The lock on the window, the drug on the table. If there's a fall risk here, check the bedsides, and there's the box. So this is the first one. First, there's a training part, then the evaluation part, and when you did 100% of the situation, then you can pass to the second module. We have 3 rooms with different isolation criteria, and the students should decide which PPEs he or she should wear on, enter the room and leave the room, and then take off the clothes, take off the other things. And we have emergency situations. This is the fire situation. You have to make calls, remember the numbers, and then intervene the fire. And when the fire goes on, you should know what to do. And we have codes for CPR case also in this one. And this is for blood culture. It's a step-by-step learning phase. And you can track the success of your students in each group. You can track who succeeded the whole case, and here he completed the session in his 5th trial, and the first 4 he had some missing parts, or he has some faults here, missing parts, and he didn't even think about these parts. So there are 11 steps to be covered in the patient room, for example, and you can see which steps or which issues are missing in most of the students, so you can reorganize your education regarding to those missing parts. So it's not only a kind of game, it's also a needs assessment for your further training planning. And we began to use those virtual reality program, and all our students, we tried to get feedback from our students, and they are very interested in playing those serious games. And when you send boxes to students and try to prepare new things for their missing period of education, they really feel that their school are dealing with them and trying to find solutions for their missing face-to-face education time. So these are the things we are trying to do in the COVID era. Thank you so much for listening to me, and I can answer if you have any questions.
Thank you, dear Dr. Elchin, and thanks for your complete description about simulation using in Turkey. And now we are reaching the part of answering questions from the audience. And I want to ask the audience, if you have any question, you can write it down in the chat box, and our prestigious speakers will be answered to you. And we have 30 minutes for it. Do you have any question, dear audience?
Mariam,
Yes, Doctor.
just for the ice breaking, may I have the first question, please?
Yes, absolutely, sir.
Sure. This question goes to the three respected speakers here, all of them. Maybe I wish to have their comments. And in the era of e-learning that we are actually being pushed into it, and there is a problem, a phenomenon of cheating. There comes some circumstances that maybe these talented youths, young people, have the ability to make groups either physically or virtually, and put into groups and maybe take these tests and go through these examinations and games, helping each other. And that's some problem. Actually, I know this is a very international problem. There are some ways like proctor exams or so, but I want to hear your experiences during making these very interesting experience. Thanks.
Well,
yeah,
I fully understand your concern about cheating, and from an organizer of OSCE, I do have the feeling that having everyone in a different place, you lose control. You don't know what's going on with the standardized patient. You don't know what's going on with the student, with the faculty. It is, you do lose a lot of control. But, and it might not be as ideal, but I think eventually we'll figure out some better ways to stay on top of things. And I know that there are lots of technological innovations about eye movements, scanning eye movements, and looking at the video in the environment that people are in. So I think that there will be more opportunities to regain control, but it might not be, that might not be totally possible. But I think we have to start also to rethink about professionalism. We have to think about student learning, about assessments that don't require these issues. I mean, this kind of concern, that where these concerns are less important, where we ask them to perform something where they cannot cheat. It's not just a matter of getting the diagnosis right or getting the questions right, but it's how you're asking the questions and how you're connecting with the patient. So I think those things they will not be able to just cheat on. And I think will go more into that direction in the future.
Yeah, I have the same thoughts with Elizabeth. We are on the simulation part. We are really lucky because we evaluate the performance, and all those, they may take some notes in front of them. They have to perform it, and you can evaluate if he has done it before or for the first time he is doing something. You can easily understand what's happening in front of you. So while evaluating the performances, it's not an issue of cheating. It's not an issue, but for the cases you expect some decisions or something like that, then it is a real problem for cheating. Or in written exams or multiple choice exams, it's not an issue for today, but these are the main areas of cheating for students. There are some, you can put some rules and you can lessen some of the cheating parts, but you should accept students can cheat and decide according to this, instead of trying to prevent their cheating, because it's really impossible in those days of technology. They can easily find something to cheat, some way of cheating. So instead of preventing cheating, let's accept that to some degree they can cheat, and we can prepare questions according to those. Instead of one question and one answer, we can try to make them explain something and doing step-by-step explanations instead of just what is your answer questions. You can make them think and explain, and it will help, I think, to prevent cheating.
Yeah.
And thanks for your comments. And I have one or more comments that I usually during this time, in order to inhibit to do the cheating with the students, I gave them separate project. Then it needs more time to spend on that project, and they couldn't cheat in this case.
Yeah.
Thank you.
Dear Mariam, you have to unmute. Yes.
Sorry. Sorry. Do you have my voice? Thank you a lot. Dear Dr. Kakur, some of our audience asked a question from you. She asked, in TUMS, we have numerous great achievements both in the virtual education and in the student assessment so far in COVID-19 era. But in OSCE, we have more difficulty. As you mentioned in your invaluable experience on virtual OSCE, the patient is trained a simulator and all of the students are assessed simultaneously and synchronously. So we not have any issues regarding the ethics, medical professionalism, nor the cheating to get the greater score. Am I right? It was her question.
Mm-hmm. So in the OSCE, we are doing it via Zoom. Most places do it via Zoom. And you have the stations in breakout rooms. And as a organizer, you can also look into the different breakout rooms to see what's going on there. But I think the issue of control is one that is not so easily solved, and cheating cannot be totally eliminated. But I think we have I attended a very interesting session, webinar some time ago about cheating. And we need to look at cheating not just as a professionalism, but also as a mental health issue. Because as students are cheating, they are often desperate, and it will reduce their self-esteem. And so I think we need to look at it from a different perspective as well. Not just that they are doing something they are not supposed to do, or it's against the faculty, or it's against the academic institution, but we need to understand it in a more deeper way. And I think that could help us maybe to eliminate some of the cheating as well. So not just to say it's bad, but why do you do it, and how does it make you feel? And you're missing out on learning, which is the ultimate plan, objective of the training. So, so that's what I'm thinking. Maybe some of my others, of my colleagues, have some more thoughts on that.
That's totally right. If these young people believe that they are going to be physicians and they are going to heal patients, that's something that might have impact on the way they think about the exams, and actually they are here to learn something and use it in the near future. Of course, these are talented people, and if they decide to cheat, they are very strong in making innovations in this way.
Thank you, dears. And do any question the audience have? No one?
Maybe we can reflect on what we just heard. The way Dr. Elchin and his colleagues have gone through is very innovative. Actually, they have put the students who are remote from the university in the field by sending those bucks, 1,500 bucks, into their homeland, and even into the other countries. That's a brilliant idea, and that needs a huge amount of logistics, and it's really impressive. I have a question. Is that just done in your university, or that's something done in other universities as well? Because the logistics and the cost seems high.
Only in our university. And as I mentioned, only the medical school, unfortunately, the dentistry school couldn't find any funding for 170 students, which is very 10% of our students.
Yes, very interesting.
Yeah.
And only in medical schools, like in maybe pharmacy, faculty of pharmacy, maybe for the lab experiments, that's very hard. It seems we are entering an era of pushing the boundaries in e-learning. So we have to make innovative experiences, and the technology should go push forward. Maybe Google and Facebook or Zoom would innovate in making some new technologies based on AI or something like that.
Yeah.
Okay, it seems people have a few questions.
Yes.
Maybe that's why. That's because
Yes.
we have had good speakers and very nice briefings and presentations here.
Yes. Mariam asked about how can we get the virtual equipment in TUMS?
Good question. Actually, I have some answers to that.
Do you have money?
2 weeks. Actually, Dr. Elchin, actually, we have a research center here at TUMS, located in Imam Hospital, in the in the most northeast part of Imam Hospital. I ask every people here at TUMS to have a visit there. My respected colleagues there, a multidisciplinary team made of both physicians and engineers. Dr. Mir Bagheri is graduated from Sharif University of Technology. That is a very well-known engineering institute in Tehran. They are making these instruments, actually. They're developing it. Yes, I just visited there 3 weeks ago. They have had 10 instruments made there, and they are making exports to Indonesia. Their new plant is being made in Indonesia, in East Asia, and they are the productions will be made there and exported to other countries there. Also, so they have some instruments there, including VR, and both the hardware and software. They have, these instruments to simulate LP, lumbar puncture. These have haptic feedbacks. When you push this needle into the place you should, it gives you, haptic feedback. That means when you go through some hard skin, you have to push more. And when you pass you pass through it, that goes like easily. So that's something really, really interesting. The problem is they need maybe a big space to host the residents, our clinical residents there. They are going to provide that in the near future. So of course these are highly costly, and but we are going through some business model to share some of the costs with the research part of the university. And actually, I'm the director of the education part. We mostly use the money. Somebody has to provide it, and most money is in the research part. So we have to go into negotiations and go through sharing.
Having the idea or having the knowledge is not enough for product development. So you have to find someone to invest on this. So you should work academy and the companies together to make improvements in this field, especially in the times of not being able to do something face to face, using all those Googles, you have problems because you may invest some money for 5, 10, or 50 Googles for 500 students, and they can share in the normal times. But now they cannot do this. So sharing such instruments is really a problem. Doing something in the simulation lab or in the clinical skills lab is really dangerous for that reason, because there are limited mannequins and some groups come and work on it, then you have to clean it before the other group. So it really makes a huge work to prepare the environments. And we chose the screen-based part for this reason. It's more cheaper than using those instruments.
That's right.
And also I should add that one of the pictures was regarding the lumbar punctures, which was regarding VR, the use of VR in Imam Hospital. And Dr. Aghili also from Pendar organizations, knowledge organizations, gave it to me and give some information in this regards. But the case is that we should have several, VR in different fields in order to can cover all parts of the performance that the students did before in their clinical exam. However, this VR makes safe and also makes ethically very useful for the students. And if you let me, Dr. Mircheraghi, who is one of our colleagues in Hacettepe University, wants to give a comments. Mariam, please turn on his microphone.
Thank you, dear doctor. I want to correct Dr. Aghili from Padidar knowledge base. Yes, Padidar knowledge base company. Yes, Dr. Aghili, yeah. And dear Dr. Mircheraghi, may I ask you to rise up your hand, and if we can turn on your microphone then. Dr. Mircheraghi, do you have our voice? Yes.
Yeah, thank you.
Hello, doctor.
I say,
hello, doctor.
I should say, hi, thanks for pretty presentation and good knowledge transfer between participants and lecturers. I'm Dr. Mircheraghi, a physician and the founder of a knowledge-based cooperation in this field. We make VR and AR softwares. I had several comments for how to use VR and AR effectively in this period. I should mention that unfortunately, because of the high expense of VR hardwares, it's not easy and affordable for most of the students all over the world, and it's not easy to produce softwares for all of the students. And unfortunately, it can be used just in skill labs, and it's not very easy to use in this situation. So we can, although interactive VR scenarios are more expensive, non-interactives are less expensive, and we can use them. For example, you can simulate their site visit in rural health systems. That it is not very expensive. You can use VR cameras, and me and my students made some scenarios, for example, excuse me, site visits, and some scenarios of about professionalism and medical ethics. It was very simple, and we made it with low expenses and in about less than 2 weeks. I think it's a good policy to go and make such softwares or such scenarios and to share them. We had experience, but according to what Dr. Shirazi said, they are sporadic and not well distributed. I think one of the best policies is to change our method to non-interactive ways, and we give this opportunity to more students with, especially in low-income countries. Another suggestion is to use AR, augmented reality, because it has it is less expensive, and it is easily affordable, and it can be used with simple smartphones, with simple tablets, and we use this method to teach some anatomical or physiological session, for example, anatomy of hearts, or physiology of hearts, or for example, some tracing of electrical records of heart in some of our books. We can use augmented reality in our exam, and it can be used as a useful tool for remote exam. For example, making a paper-based exam, and we tell students that print them, and then we give them the AR software, and they can guess what is augmented on those paper. We are doing this, and we are developing this type of exam, and I think these policies can make the road easier and make the road affordable. I think it can help us to promote these technologies for more students worldwide. Thank you.
Thank you, Doctor.
And I want to add something. The national efforts like yours is more valuable because the international products are all in English or in Spanish sometimes, but mostly in English. And many countries cannot use them in their local schools. In some schools, we have some students that can easily manage the English version of things, but in many of the schools, students have difficulties to understand the English version of such experiences. So the national products are more important, and we should invest on local companies and work together, academy and the local companies, to develop our own products in our own languages. So thank you for your efforts.
Thanks a lot. And at the moment,
yes.
Dr. Sohrapur.
Thank you, dear audience. Yes. If you don't have any questions, Dr. Shirazi.
Okay.
Turn off your, please, turn off your microphone, please.
Okay, yes,
Thank
yes.
you so much.
Yes, it's turn on. Turn on.
Thank you so much. Do you have my voice?
I have.
Yeah. Now we are reaching to the end part of the this webinar. It's for wrap up, and I want to ask our prestigious speakers, especially Dr. Sohrapur and Dr. Shirazi, to summarize the meeting, and Dr. Kakur and Dr. Elchin, if it's possible for them, to wrap up the meeting, and they go for the end of the meeting. Dr. Sohrapur and Dr. Shirazi, we are here from you. Oh. I think he was disconnected. Okay, Dr. Shirazi, please. Dr. Sohrapur, do you have my voice?
Yes, I'm here.
Yes, we are getting to the wrap-up session.
Yes, I'm sorry for the interruption. I don't know why. I just jumped out of the meeting. I'm glad I'm back.
Me too.
I have to thank our respected guests for the very wonderful meeting we just had, the webinar. Dr. Shirazi reviewed the basics of simulation, what it is actually, the history, the categories, and the elements of simulation-based education systems, including teaching, assessment, curriculum design, feedback, which is very important, research and measuring impact and outcome. Then she mentioned the different kinds of simulation used here in Iran in the COVID area, in the COVID era. Of course, we're in the beginning, but we have little but significant experience.
We haven't your voice. Maybe I should turn off.
Dr. Sohrapur, do you have our voice? We didn't hear anything from you, Dr. Sohrapur. Okay, Dr. Shirazi, may I ask you to continue this session?
We'll continue. I think that it was very interesting. Webinar, not just for giving some information just regarding the simulation or whatever, virtual reality and other things, but regarding the comparison between the situation between the countries, which it happens for our culturally and also for the situation that we have. For example, in Iran, we have a limited budget. However, Dr. Sohrapur did his best for gathering this budget, for example, for our university. But it doesn't happen in all university. And as far as I said, we use it sporadically. And I would like to ask you, Meli, that the virtual reality that you are using in your country, and not the package that you distribute, the virtual reality is used commonly in all of your university, or just in your university they are acting like this?
It has been developed, not finished yet. It has been developed in our university with a collaboration with a company. So we use the product without any price. But other institutions who want to use it have to pay money to the company. So it's a very commercial product at the end.
By the way, I am seeing that the most important factor is finding the budget for supporting this kind of the program. And actually for some sanction and something that we are involved on it in our country, sometimes it's hard for us to reach. And Elizabeth present very nice OSCE in the virtual situation, which is very valuable also for all of us. But in our country, by considering our limitation, we consider some protocols in order to inhibit the infectious, and did the national OSCE very successful, which is also valuable for us, for our situation. But I know that in the second round, we should go through the virtuality and using more of this virtual reality. However, we need some support. However, Dr. Sohrabpur did his best in this regards, and also other colleagues who are working in this area. Elizabeth, can you estimate how much money you have spent for a virtual exam, and also were all of your faculty satisfied with this kind of exam, in order to be sure that the competency were gained by over acquisition enough competency for graduate from medical schools?
Okay, well, I don't know whether I can put a dollar amount on that. I know that it costs maybe a little bit more because there are some technical issues that need to be dealt with, but there are also some savings in terms of time, in terms of availability of some faculty who can join via Zoom, but they can't go there physically. So one has to balance the pros and cons. I think in general, the faculty, it's been taking them, some of them, a bit of a adjustment to change their view of how things are being done. I think initially they wanted to go back to the normal OSCEs, where everything is in person, under control. And it took them a little while to realize that the normal situation is not going to happen so soon. And it is important to continue training, formative as well as summative, in a different way. I think COVID is providing us a restart button where we have a chance to rethink what we are doing, and we can maybe do it differently. Virtual reality, remote encounters. We really need to take this as an opportunity to move the whole field forward. But of course, there's resistance, there's money issues, definitely. Also in the US, the money is not plentiful. Resources are not available everywhere. And there are many students, many institutions who have lost a lot of money over the last couple of months, last year. So it's really something that we all have in common, and we need to figure out better ways to manage the economics of it as well. The human side, the economic side, the technical side. I think clearly we need to have local efforts to make things work for your own place. But I think we must also work together internationally, because even though we may speak different languages or live in different places, but we do have very common interests and very common concerns. And I think we need to work together on making the best of a difficult situation.
Of course, thank you very much. And sorry, Dr. Sohrabpur, because it was, and then I had to replace and speak instead of you. And could you please continue? Or
yes,
yes,
I just apologize, and the dropping out of the meeting mentions one other problem in the era of e-learning or online education, and that is digital inequity. That is, some people have low-speed internet or drop out frequently. So that's one problem. Of course, here in Iran, we have a rather high-speed or well-speed internet for having meetings, and we use it daily.
Unfortunately, now we don't have Dr. Sohrabur again. Dr. Sohrabur, are you live here? Connect. Is he connecting?
So you can see that how
Yes.
problem. Oh yes, you're here.
Now here.
Continue, please.
You know, it seems I'm in a deprived part of the city here. I have low-speed internet, and it disconnects frequently. I go through the wrap-up part. Dr. Elizabeth mentioned the cycle of stabilization, recovery, and then preparation and response. And since we were shocked by the problem COVID-19 put rather violently, they in their experience had to go through stabilization phase, and at first everything was stopped and was postponed, but then OSCEs, virtual OSCEs has come into place, and they are actually the norm in different parts of the country. The network part was interesting to me. That is the Association for SP Educators. We made the professional networks, and that was actually very central to making the stabilization and going through recovery and making young physicians prepared for the future telehealth and telemedicine that actually we're going towards. Dr. Meli Elchin described the very interesting experience in the Hacettepe University.
Unfortunately, we don't have him again. I don't know why it has happened. But some of our audience asked a question about the machine learning and machine intelligence in computer, and ask about the diagnosis of COVID-19 by software can under test from our university and scientific research at all aspect part of the life as education, medicine, and different foundation. But I can't understand the right question of him or her. May I ask him or her to write it down in a brief statement, please? Dr. Sohrabur, we have you here again. Please
Yes,
continue.
I'm really sorry. I don't know why this comes through, but after being stopped everything in Turkey, they started doing pilots mainly in dentistry faculty using Zoom in communication skills field and clinical skills field. They sent those $1,400 into the students' homes by post with no cost put on the students. And they started doing clinical skills, hands-on clinical skills, learning how to make sutures. And that was really interesting. of course, they set up a computer center for educating people or the students for communication skills. And also the VR part was started, but due to the cost of VR head-mounted cameras, that was not very feasible, maybe. And also, he pointed out the serious games experience using the VR, and this was an innovation put in place so that if we cannot provide VR cameras to everybody, we can make up or set up serious games for them to use the software to learn medicine and in different fields like doing blood culture, the confidentiality, the patient safety issues. And I personally made use of the presentations very much. I should thank you very much for the very fruitful speaks we just had, and it was my pleasure to be acquainted to our respected guests. I hope we can continue this mutual collaboration for learning and for learning by me and from your experience and making good things. Thank you very much.
Thank you, dear doctor. Before I say goodbye to everyone, I want to ask all of them to turn on their webcam to have a fortune for us to get a group pictures and group photos for the news of this webinar. May I ask all the audience, please, turn on your webcam, please. Oh, hello, dear Dr. Mirzazadeh. Hi, Dr. Mirzazadeh.
Hi, Dr. Mirzazadeh.
Can we have you here?
Great to see you, Azim.
Good afternoon, good morning for Elizabeth and other colleagues. It's my privilege and honor that participated in this interesting webinar and learned a lot about the experiences in Turkey, in the United States, and also in Iran from my colleagues in International University of Medical Science and also in other parts of the country. Because at the sake of time, just thank you a lot.
Thank you so much. And we have Dr. Mafin and Dr. Mafakhari also, and say hello to them. And I want to ask all audience, please turn on your webcam to have a fortune for us for take a group photo.
One take.
Do you have my voice? Ms. Sadeghi, I think has a comment.
Yes, we can hear you.
Yes, we hear you too. Do you have any comments, Ms. Sadeghi?
I'm taking several screenshots.
It seems people are there and they are awake.
Please smile.
Is it done, Ms. Sadeghi?
Yes, it is done.
Thank you so much. And at the end, I want to say thanks for the audience and our prestigious speakers from all around the world. And I'm so happy to hear and being with you. If you have any comments or statements, we are hearing from you. And if you don't have, I want to say goodbye and have a good time.
Thank you
Bye,
very
everybody.
much.
Thank you. Bye-bye.
Thanks for your time. Bye-bye. Bye-bye.
Good luck for everyone.
Okay, bye-bye.
Bye.
Bye-bye.
Please.